Hi everyone, I am Dr. Sagar Sahu and welcome to Vet Surgery at Each. So today I welcome you to the 7th lecture in the series Orthopedics. This is the actually second lecture in the sub-series, you can say, the fracture fixation system. We have already discussed the external coaptation bandage technique. Today we will be discussing the external fixator system, or sometimes it is also known as, or more commonly it is known as external skeletal fixator system. Okay, so in this particular class we will be discussing three types of external fixator or external skeletal fixators. First one is the linear, second one is the circular, and third one is the hybrid. For linear and circular we will discuss more thoroughly, and the hybrid only the concepts. Okay, because hybrid is not that commonly used. Linear and circular is commonly used. Linear is more commonly used than the circular one. So we will discuss these two vividly. Before going to the lecture, some formalities. You know that if you are new to this channel, please do subscribe to this channel, and if you are old and still not subscribed, please do subscribe. And if you are liking the content of my channel, there are different segments or different playlists: anesthesiology, general surgery, radiology, and this orthopedics going on. There is also some surgery videos of different species wise. There are playlists. Okay, so if you are liking this content, please do share this channel among your friends, colleagues and juniors, different Instagram pages, or WhatsApp groups, all those things. Okay, it helps me a lot to grow. Okay, and do follow me in Instagram. It is very important because I post all those notes and updates regarding the videos. In Facebook I do post the pictorials of different case reports. This is the books. This is sorry, not books, book. This book I am referring for preparing the lectures of this particular orthopedic series. This is a very good book. If you want to read further, I will give the link of this book in the description through a drive link. And don't worry, I will also provide the link to the PDF for in the PPT in PDF format, as well as the class notes of this particular lecture in the description. Okay, so you don't need to take any notes, simply listen and understand the concepts, then revise with the notes. Okay, download the notes and revise it with. So I told you there are three types: the linear, the circular and the hybrid. So let us start with the linear external fixator. So there are some indications regarding the LEF, that is linear external fixator. Okay, I sometimes fumble. So the indications: the long bone fracture, mostly it is very commonly used for the fractures below elbow and a stifle in hind limb, although it can also be used for humerus and the femur. Corrective osteotomy, joint arthrodesis, temporary joint embolization, these are kind of slightly advanced techniques. We will most focus on the fracture management. Okay, from fracture management point of view, there are different types of linear external fixator, LEF. So there are basically three types: type 1A, 1B, type 2 and type 3. Okay, these three. Let us understand some basics. We should first understand. You see, this is a bone cross sectional. Suppose this is a tibial bone. Suppose this is tibial bone. This is left side. Animal is standing like here. Here is the head, here is the tail. This is the left tibia. I'll take a cross section and this is the view. So what will happen? So this will be the medial side. This one is the lateral side. This is cranial. This is caudal. Okay, so the plane which divides this bone to cranial and caudal is the frontal plane. This is the frontal plane. The plane which divides the medial and lateral is this is sagittal plane. This is sagittal plane. You remember these planes, because when I will be discussing regarding the placements of pins, I will be simply telling this is in frontal plane, this will be in sagittal plane. Okay, so this one is the frontal plane, frontal plane which divides the bone into the medial and lateral side, and this is the sagittal plane which divides the bone to medial and lateral. Okay, now that classification of linear LEF, linear external fixator, is based on number of sides the pin penetrates, and number of planes it occupies. On the basis it is classified. It is mostly classified as type 1A ESF or EF, type 1B, type 2. This is not a kind of further sub classification, it is simply minimal and visual, I will discuss, and type 3. So type 1A is also known as unilateral, uniplanar, uniplanar. Okay, unilateral, from one side it will penetrate. Here actually the half pins are used. We will discuss regarding the pins also. Half pins, it will not cross the other side, only from one side. Okay, so unilateral means one side. Here is one side, in this particular one side. Okay, uniplanar, this is one plane. Let us understand here actually. So what happens actually, you will use a half pin, it will be like placed like this. Okay, so from one side it will be penetrating. So unilateral, and this is one plane. Which plane this one? This is the frontal plane. Okay, that is uniplanar. Simply the modification of this one is the type 1B, or some advanced version is the type 1B. Here the another pin is added at the 90-degree angle, that is on the sagittal plane. Here also the pin does not penetrate to other side. Okay, so it is unilateral. So this will be the unilateral. This is unilateral but biplanar. Here it is also in sagittal. This is frontal plane, this is sagittal plane. Both are using half pins. Okay, and they are penetrating from one side. So unilateral biplanar, type 1B, type 1A, type 1B. Now what is type 2? Type 2 is bilateral, uniplanar. So here what will happen? Here you will use full pin. What will happen? Bilateral, it means the pin will penetrate entire through the bone and come to the other side like this. This is single plane. Okay, this is frontal plane. Okay, bilateral, it is penetrating two sides. Bilateral but in single plane. Bilateral uniplanar. What is sub classification 2A, 2B? In 2A, you are using all the pins to be full pins. These are full pins. All pins are full pins. While in case of 2B, the most extreme pins will be full, other pins will be half. Okay, so simply type 1A is also known as type 2 maximal. While the 2B is also known as type 2 minimal. In the book it is described like that. Maximal and minimal, both are type 2 and bilateral uniplanar. Okay, though you are using other half pins, but there are full pins which are crossing the other side. Okay, so it will be bilateral uniplanar. Understood? Now this the advanced version of this particular, which is bilateral biplanar is type 3. Bilateral biplanar is type 3. Okay, understood? How it will look like this? Here a sagittal plane will have added. Bilateral, it is penetrating both sides. Biplanar in two planes. Bilateral biplanar. Understood? This is basically the classification of linear external fixator. This is some pictorial image from the book which I took some screenshots. Type 1A, unilateral uniplanar. You see, unilateral penetrating one side and uniplanar. Type 1B, unilateral biplanar. Okay, it is in 90 degree and unilateral because it is penetrating only half of one side. Try maximal type 2. Here all the full pins will be used. Bilateral uniplanar. Type 2 minimal. Here two full pins. The most extreme ones will be the full pins. Rest are half pins. Okay, understood? Here also you see what are the equipments or components of LEF. We will discuss now, but before that you should see what are the components. First component is, you see, the pin. First one is the pin. Next you see the clamp. This is the clamp which attaches the pin to this one is the connecting bar. These three are the major components of this linear external fixator. Okay, or LEF, linear external skeletal fixator. Okay, all those things. Let us discuss these components also. First one is the pin. Okay, pin. You see pin, mostly the threaded pins are used. So the threading can be of two types. It can be positive profile threading or it can be negative profile threading. What is the difference? You see, this is the smooth surface. Smooth surface. This is the threaded surface. Threaded. So the smooth surface has a diameter. This one is the diameter. The diameter of smooth surface, and here is also you can see a diameter of the threaded. The core diameter, you can say core diameter of threaded section. So when the diameter of the smooth section is equal to the diameter of threaded section, then it is known as positive profile pin. Positive profile pin. Similarly, here you can see this is the diameter of smooth surface, diameter of threaded surface. You see this is the diameter of smooth surface, but look at the diameter of the threaded. It is less. When the diameter of smooth surface is more than diameter of threaded surface, it is negative profile. So this is negative profile pin and this is positive profile pin. So basically the negative profile is not that used because it is weak at this particular point. When this diameter is lessened, here immediate lessened, it's this particular point it may break. Okay, but there are some advanced or modified negative profile pin with the taper. So what will happen, instead of instant bending or instant reduction, it will be like this, tapering. Okay, but most commonly positive profile smooth threaded pins are used. Now this threading can be end threaded or it may be centrally threaded. For this particular lecture of point of view, the end threaded pins are half pins, and the centrally threaded pins are full pins. Okay, on the basis of location, it can be end threaded, it can be centrally threaded. But for this particular lecture point of view, end threaded pins are half pins because it will be easy to understand. They are half pins while the centrally threaded is full pins. Okay. Now there are some special type of pins known as acrylic pins, or sometimes they are most commonly used for mandibular fracture, so also known as mandibular pins. What happens, these half pins are full pins. When you to this smooth surface, a clamp and a bar will be attached. You saw the picture, but this particular where you will be using acrylic resin or epoxy resin. So for that, this smooth surface is not an ideal thing. So here you see this is the threading, this is end threaded. Acrylic pins are mostly end threaded, but it is also has some corrugation here. For what purpose? To hold to the acrylic resin. Okay, the acrylic resin can hold more firmly. That is why this particular corrugation is provided. This is acrylic pins. These are comparatively smaller, very small to these pins. Okay. Now regarding the threading, you see these are threads. Okay. So suppose I will take a measurement of 1 centimeter. Okay. Suppose. So in 1 centimeter we find 1, 2, 3, 4, 5, 6 threads. Here 6 threads. There will be pins in which you will find 3 threads. Okay. You may find. So when the pitch, this is known as pitch. When the pitch is high, it means thread is high. It is known as cortical pins. When the pitch is less or thread is less, those are cancellous pins. Or they are used for drilling through cancellous bone, and the high pitch they are used for cortical ones. Look here, this is end threaded, but this is cancellous. This is centrally threaded cancellous. This is end threaded cortical. This one is cortical pin. End threaded cortical. This is centrally threaded cortical. Okay. Now you have clear idea regarding the pins. Okay. Most importantly, remember the half pin, which are end threaded, full pins which are centrally threaded. Usually the half pins are used for unilateral approach, the type 1A and type 1B. For full pins are used in type 2 and type 3. But in type 2 minimal, both half pins and full pins are used. Okay. Next you see some images, again some images. You see this one, this is centrally threaded, this is also centrally threaded. Can you tell which one is the cortical, which one is the cancellous? Okay, this one is the cortical, this is the high pitch, this is the cancellous one. This is end threaded, this one is cortically end threaded, this is cancellous end threaded. These are basically half pins, these are full pins from this lecturer point of view, although this can be of same length. Okay, and this one is the acrylic pin, they are comparatively very small. Okay, so these are basically pins. Now the bar, the external bar I told you. So the external bar has three shapes or three sizes. It comes small, medium and large. Also it has different materials, like it is the stainless steel, the titanium, then the carbon fiber. All those materials are can be used. Carbon fiber is lightest and strongest, then the titanium, then the stainless steel. This is basically the external connector or external bar. Next is a clamp. The clamp, there are two types most commonly used. One is the secure K, another one is the SK. This is SK clamp, this is secure U clamp. Okay, in the secure U clamp you will find a U-shaped structure for holding into. This will be holding the bar, this will hold the external bar, and it has one bolt. This is the bolt and this is the knot. Okay, so the head of the bolt will have two holes. Here you can see one hole, here is another hole. It is of different size to hold different size pins. When you will tighten this one, it will hold the pins. This will hold the fixator pins, and this will hold the bar. Okay, this one will the bar. Now the SK clamp, you will find two bolts. Here is one bolt, here is another bolt. Okay, one bolt will have a head for holding into pins. This will hold pin, and this particular hold, it has two separate structures. When they will attach, they will hold into the, this will hold the bar. Okay, this is single clamp, this is double clamp. This particular double clamp is used for holding two bars at a time. Suppose you want to connect two bars. Okay, so in that particular case you can use double clamp. Okay, so this is basically the clamps that can be used in linear external fixator. Next is the equipment of the aiming device, pin aiming device, universal pin aiming device. Why it is needed? But you know that when the bone, suppose this is the bone, you have to drill, so you should know that from where it will come out. Okay, especially when you are doing bilateral. Okay, so this particular device can help you to identify this. You will be inserting side, and from this side it will come out. Okay, so that you can mark that particular, this point it will be entry point, this will be exit point, and this particular thing can guide you through which you can drill the pin, and it will come in other side. It will help you planning the exact length, or you can say you can design the external skeletal fixator very nicely. Okay, so this is basically the universal aiming device. Next is the application. Before going to application, some basics regarding application. So type 1A frame, it can be used for radius, it can be used for tibia, it can be used for femur and humerus. Also it can be used for carpal. Okay, metacarpal or metatarsal. So when you will be using in radius, most commonly these bones. So for radius you have to give or craniomedial. See here, this is a medial, lateral, cranial and a caudal. So you have to insert pin like this for the radius, like this. Okay, half pins will be used, 1A, type 1A, unilateral, uniplanar. For tibia, the insertion point is medial. Okay, like this, For femur and humerus, it is lateral. You know that you cannot approach from the medial side because thigh is there and the abdomen portion is there, so you cannot approach from that side. But these external skeletal fixator are rarely used for femur and humerus because it has very thick muscle coverage. So while drilling or doing something, it is very painful. Okay, but it can be used. Okay, it can be used in tie-in configuration. Let me tell, I will explain. Okay, there is tie-in, I will explain. So for the femur and humerus, the approach from lateral side, your mostly half pin will be used, end threaded, half pin is end threaded. So type 1B, which is unilateral biplanar. So here for the radius you have to craniomedial and craniolateral. This is craniomedial and another one will be at the 90-degree craniolateral, like this, craniomedial and craniolateral. For tibia, one is medial, so another will be the cranial, like this, medial and cranial. This is for tibia. Type 2 is bilateral and uniplanar. So for radius and tibia, it will be inserted to frontal plane. I told you regarding the frontal plane. Frontal plane is like this, frontal plane, which divides the bone into cranial and caudal. For type 3 simply we will add a 90-degree, like this, frontal and sagittal. Okay, type 3. Now there is a concept known as tie-in. Here it can be used to make it useful for the humerus and femur. Okay, so what will happen, you have to use a IM pin, then you have to tie in. So the approach is lateral. Obviously for ESF the approach is lateral. Suppose this is femur, though it is tibia fibula, suppose this is femur. So what you will do, you will insert a IM pin first. You will insert a IM pin like this, then you will do the ESF through half pins like this. You will do the ESF 3, 4, 5, 6, like this. Did the ESF. Now to the ESF you have to join this pin, intramedullary pin, like this you have to join. You see this is a bar and this is a bar, so you will use the double clamp. Okay, here the double clamp is used. So like this you have to tie in the intramedullary pin and the ESF. This is known as tie-in configuration. Okay, tie-in. Let us go for what are the principles of application. Principle of application, because this principle will remain same. Your application procedure may vary, your method may vary, but these principles will always be same. Understanding the principle is very important. So what are the principles? The first principle is you should do pre-drilling before inserting fixation tips. Usually the pre-drilling or the drill bit is used for drilling. So drill bit, the size of drill bit should be 0.1 millimeter less than the fixating pin. Suppose you are using 4 mm fixating pin, then it will be 3.9 mm or less. Okay, so that you will use a drill bit of less than, which is 0.5 mm less. You have to do pre-drilling, then after you will insert the fixation pin. Next, the pin number. More the pin number, better is the stiffness of the ESF or EF. Okay, but there is a limit, maximum 4 pins per segment. Suppose here is the fracture, you see here is the fracture, so per segment you can use maximum 4 pins. Okay, maximum 4. Okay, more the number, stiffness is more, but maximum is 4. And what about the size? If you are seeing the pin size, maximum is 25% of bone diameter. Suppose this is the bone diameter. Okay, then maximum is 25% of this one. Suppose it is 10 mm, so it will be, maximum will be 2.5 mm. Okay, like this, maximum is 2.5 mm, or sorry, maximum is 25% of the bone diameter. Next, first 2 pins, when you will be drilling first 2 pins, it should be most proximal and most distal metaphysis. Okay, suppose this is the fracture of this particular here, so the first 2 pins you will be inserting will be the first proximal and the first distal. Okay, most proximal, most distal metaphysis. This is the first 2. Next 2 pins you should insert just proximal to fracture and distal to the fracture. There is some measurement regarding the distance from the fracture line. In some books you will, or in some articles you may find it should be 1 centimeter from the fracture, but the most appropriate one it should be 1 bone diameter away. 1 bone diameter away. Okay, suppose this is 10 mm, so it should be 10 mm away, because when it is 1 bone diameter away, we know we deal with different species, and also even in the dog breeds there is a lot of breed variation, so the bone diameter will be different. So this inserting of the proximal and distal pin in relation to the fracture line can vary. Okay, it is kind of more appropriate, 1 bone diameter away, otherwise you can see 1 centimeter away from the fracture line. Okay, so next two pins will be proximal and distal to the fracture line 1 centimeter away or 1 bone diameter away. After that, now the per segment, here 2 pins, here 2 pins, maximum is 4 pins per segment. If you need, you can insert 2 more, or you can simply manage it with another 1 pin. Okay, whatever you have decided, depending on the fracture assessment score, depending on the breed, depending on the animal, depending on the owner compliance, all those things. Okay, now decrease the distance between skin and pin clamp. You have inserted this pin, okay, like this. Suppose you are using full pins. So here will be a bar and here will be a bar. This is bone, here will be the skin. Okay, here will be the limb and the skin. So you have to decrease the distance between this bar, or here will be the clamp. More appropriate is the clamp, but because clamp will be slightly towards the skin, so this clamp and the skin interface, it should be minimum. It should be 1 finger away, 1 finger. Okay, or 1 centimeter you can say. Okay, if it will be further like here, then it will destabilize the frame. If it is very close to the skin, it can cause skin wound, skin irritation, skin complications. All those things can happen. So the decrease the distance between the skin and pin clamp interface 1 finger gap. This is a principle. Next, connecting bar size and material selection. You see, it comes with small, medium and large. Okay, the thicker the bar, it is more stronger, but it does not mean that in a Chihuahua you will use the large size bar. So you have to optimally decide. And regarding the material, I told you stainless steel, then the titanium, then the carbon fiber. Carbon fiber is very light and as well as strong, but it is costly, so you have to decide. Intramedullary pin tie-in, I just explained what is intramedullary tie-in. Okay, it can be applied. Also you can apply a augmentation pin for a strength, more strength. Augmentation, sorry, I'm really sorry, augmentation plate. Okay, augmentation plate. Now you might be wondering, what is augmentation plate? Let me explain it to you. What is augmentation plate? You see, augmentation plate, and there is, you will find slight confusion regarding augmentation plate and the neutralization plate. Okay, so let me explain this one. I also had the doubt, so I asked my guide, who is kind of an orthopedic giant. Okay, so he explained, so I am explaining to you. So what will happen? Suppose, let us assume that it has a oblique fracture like this. Let us assume that it has a oblique fracture, though it is a transverse. Let us assume, because it will be easy to understand. This is oblique fracture. So what will happen? You can use, suppose you used 2 methods, different one. Here you can use a cortical pin. Okay, you have used, sorry, screw. I am really sorry, cortical screw. You have used a screw to stabilize this oblique fracture. Now, when you will be using a screw, although it is reduced, fracture has been reduced by this screw, but it is not stabilized. It is not protecting against all those forces. Okay. Regarding forces, I actually forgot to mention the linear external fixator, the LEF, as well as the circular, mostly the external fixator. Okay, external fixator, it is as well as the nail and plate. These 3 techniques, these are only 3 techniques which provides protection against all type of forces, the shear forces, the bending forces, the compression, the torsion, all those forces. Okay. So others like screws, they do not provide all type of protection. External cooperative, they do not provide wearing. Also, they do not provide all type of protection against all type of forces. Okay. So here you have applied a screw. It does not protect against forces. So to stabilize this one, or to provide additional support, you used a plate. So here the purpose is to provide additional support, to protect against the forces acting on the bone. So this is neutralization plate. It is neutralizing the forces and mostly the forces, and providing additional support to this particular fracture immobilization. here it is screw. Suppose what you have did, there is oblique fracture and you did a nail, interlocking nail. I told you nail is a very good technique, fracture fixation system or fracture fixation technique, which provides protection against all forces. So it is stabilized, you don't need anything. But what will happen, sometimes there will be micro movement in this particular fracture area, micro movement. Okay, so when there will be micro movement, sometimes it will not heal, there will be non-union, there will be some problem or malunion, not malunion exactly, non-union is the exact term. It will not get, there will not be good callus formation, it will not have a union. Although you have provided the nail which is providing protection against all forces, it is stabilized, but still it is having some micro movements at the fracture area. So to prevent this micro movement, you have used a plate, okay, for additional support, especially to prevent this particular micro movement at the fracture area. Now this plate will be called as augmentation plate. Okay, so here I used the term augmentation plate. Why I used this term? Because LEF or external fixator as a whole provides all protection against all type of forces. It is already stable, but sometimes there might be micro movement at the level of fracture or fracture line. So you can use in combination with a plate. Now the plate will be known as augmentation plate. Okay, understood? Now regarding the strength of different type of frames, you know that when there will be more side penetration and more planes, it will be more stable. So 1A, 1B, 1, 2 and 3 on the increasing order. Type 3 will be the strongest one. Okay, based on, and you have to select on one of these on the basis of fracture assessment score. I have already discussed regarding the fracture assessment score. I will give the link in the description to the playlist, you can see. Now let us come to the application part. What are the steps in the application? First, you see, for external fixator, the surgical asbestos is more important than other methods. Okay, suspend the limb and asepsis. Suspend the limb, and here some scrubbing is going on, asepsis. Now you have to decide how many pins, how many clamps and how many bars. Suppose you are using unilateral, suppose for example you are using unilateral uniplanar. Okay, now we have decided that per segment you will use 3 pins. It means total you will be using 6 pins. When there will be 6 pins and it is unilateral, so you need 6 clamps. You will need 6 clamps. If it will be bilateral, then it will be 12 clamps. 6 clamps and you will need one rod. Okay, so you have decided regarding the pin, 6 pins, end threaded half pins, clamp 6 clamps, whether you are using Secure U or SK clamp. Now regarding the bar, you have selected one rod, whether depending on species, small, medium, large, or the material types, stainless steel and the titanium and carbon fiber. Now next is decide the position of the pin, where you will be inserting the pin. So you will use a pin aiming device. Suppose you are doing in the tibia, so you will use the pin aiming device to locate the pin entry. Suppose this is 3 in the proximal, 3 in the distal. Now you will also find the points where it will come out. Okay, like this you have decided the entry point and exit point. Mark the entry point and exit point, decide the position of the pin and all these markings. There are surgical markers available, you can do the marking. Next, make soft tissue tunnel. What is making the soft tissue tunnel? Suppose you have to insert pin here, although you will not insert here because here there is gastrocnemius tendon. Okay, so it will not be inserted from this point, it will be slightly lateral. And suppose you will be using here 1, 2, 3, 1, 2, suppose 5 pins you are using. So what you will do, what is the making soft tissue tunnel? So what you have to do, first you have to give an incision, 1 centimeter incision. You have to give incision, spread the skin, and using a artery forceps or blunt scissors, you have to make a tunnel to the bone. Why? Because the book recommends that if you are drilling through the skin without making any incision or anything, you may damage the skin as well as the soft tissue. Okay, it will be more painful, more damaging. So better make a skin incision and use a artery forceps or hemostatic forceps to spread those muscle fibers and spread those spot tissue, some connective tissue, all those things, so that you can make a tunnel to the bone. That is the purpose of making soft tissue tunnel. If you are using unilateral uniplanar, then you have to make on one side. If it is bilateral, on the other side also, so you have to make the soft tissue tunnel there also by using the aiming device. Okay, otherwise if you are not having aiming device, simply mark these points and make a soft tissue tunnel here, then insert the pin. When it will be lodged at the opposite cortex or go through opposite cortex, simply tap it so that it will simply penetrate rather than drilling through the soft tissue, and it will come out to the outside other side. Okay, next step, I told you pre-drilling 0.1 mm less than the fixing pin, okay, under high revolution. After making the pre-drilling, then the drill the fixing pin. It will be done on low revolution. Next, you have to slide the clamps in the connecting bar. You have to slide the clamps. Okay, these are clamps in the connecting bar before coming to here. Okay, apart from your surgical table, you have to take a clamp and take a bar and add the clamps on the basis of number of pins you are using. Okay, next attach the pins to the bar. Simply next attach this bar and clamp, it should be attached. Next, radiographic evaluation whether there is fracture reduction and properly placement. Then trim the fixator pins, whatever the extra length will be there, it will be trimmed. And dressing and bandaging. Dressing is very important, particularly at the skin and the pin interface. This particular interfaces is very important, because these are the points through which infection can go in. Okay, so these particular, even if in post-operative days, dressing of these particular entry or exit point, if you are doing the unilateral only entry points, bilateral entry and exit points, this dressing is very important. You have to do dressings regularly so that there won't be any infection. Okay, so this will be dressed and you can do a bandaging with bed wrap or any bandage, so that animal will not mutilate or animal will not do some damage to this particular frame. Okay, so this is all about the linear external fixator bone where you have used bar and clamp. There is something or a kind of cheap method, that is acrylic splint, comparatively cheaper. Acrylic splint. What is the procedure of acrylic splint? Here you have to use a tube. Okay, tube. You can use anesthesia machine, pediatric anesthetic tubes, or you can use for low cost. You see in recent homes you will find some thin washing machine exiting tubes, that also can be used. In older houses or older times you will find some electric wires, it goes through a plastic tube. Okay, those tubes can also be used for low cost, but for surgical and for you can say the slightly sophisticated, you can use anesthesia tubes. Okay, anesthesia breathing tubes, those tubes can also be used. So what we will do, simply the step up to drilling through the fixator, drilling of fixator pin is same. After drilling, simply attach or make some holes in the tube and then place it over this one. Here actually the gap between this particular tube and the skin is 2 centimeters, slightly more. So you have to apply, then you apply, or you can place this tube then drill through. Okay, but better first drill, then simply make some holes and place it there. Otherwise you can drill through these particular pipes. Okay, tubes. So after drilling, you see now the column molding tube attached later. Here you have to do 2 centimeter from skin, it should be. Next, pour the acrylic into the column. Okay, you can use acrylic resin and also you can use epoxy resin. Okay, those two can be used. So then you have to block this one with cotton or gauze like that. Then you have to pour this resin through this one. Okay, while pouring there will be heat generation. Okay, so to prevent this heat generation, apply sponge gauze dipped in water or normal saline or sterile water. Okay, then rotate or you can say apply it to the pins, because the pins can absorb the heat. Okay, so to prevent this one, you can apply this one. So here, place the saline moist sponges and fix on the fixation to dissipate the heat. Now after application of this resin, wait for 5 to 10 minutes for curing. It will harden. Then your frame is ready. It is comparatively cheaper. Okay, and also the advantage that you can, suppose some pin is slightly misplaced, okay, or sometimes it is slightly not exactly at the exit point or something like that. So this particular acrylic splint can be slightly molded or slightly can be adjusted compared to the strict the bar and the clamps. Okay, so allow the acrylic to cure for 5 to 10 minutes. This is acrylic splint. Okay. Next, this is all about the linear external fixator. Next is the circular external fixator. The circular external fixator or circular external skeletal fixator. There are some indications for circular external fixator. It is strictly for below the elbow and stifle. The linear one can be applied to the humerus and femur, but this one is only for the below the elbow and stifle. It can be used for fracture distraction, joint arthrodesis, bone lengthening surgery. You can increase the bone length also. Angular limb deformity. These are advanced techniques. Okay, advanced techniques. If you want to study upon this one or you want to do some research like that, you can read the book. I will provide the link to the book. But we will be mostly dealing with the fracture. Okay, from fracture point of view. Next, there are some equipments. See here some equipments. What are the equipments? Here this is the connecting rod. Okay, connecting rod. This is the ring. These are wires. Here the pins are not wires, K wires. Okay, K wires are used. These are the wires, and here the wire which is attached. This is the bolt, fixing bolt. Okay, fixing bolt. These are major things. Apart from them, some wrenches will be used to tighten the knot, and suppose this thread has to be attached, there will be two knots here and here. Okay, so knots, okay, all those things are also there. Let us see the equipments. First one is the wire. Okay, equipments, wires. The size of wire selection matters on the size of body weight. For cats and small dogs up to 10 kg, you can use 1 mm wire. For dogs of 10 to 20 kg, 1.2 mm wire. Dogs more than 20 kg, 1.5 mm wire. Okay, so wire can be classified. It can be without olive, with olive. Here you can see a boss. This is olive. This is known as olive. O-L-I-V, olive. This one is without olive. This one is with olive. Another thing, it can be also be classified on the basis of regarding why olive is needed. Suppose here, let us understand here. Suppose this is cross-sectional view. You are using wire without olive. Okay, simply you have inserted your fast wire. There is every possibility that this particular bone, it can shift through, or it can place, or it can move along this particular line. If you will add a olive here, suppose olive is attached here, now the movement is restricted. For this purpose, this olive is used. Another importance of olive, if you are very much pro, okay, in orthopedics, suppose what will happen, sometimes this fragment will be fractured. Okay, so you can insert a wire through a olive. Here the olive will be attached and it can provide compression, especially suppose there is a butterfly fracture. Okay, so you can use this one for compression also. Okay, but it is not matter of subject here. You can use if you are an advanced surgeon. So this is olive, with olive and without olive. Another thing is regarding the point. Okay, here you see this is one type of point, this is one type of point. This is bayonet point. Here you can see bayonet point, and this one is a trocar point. Trocar point. Bayonet point or bayonet point, however you pronounce, this point is basically used for drilling through the cortical bone, cortical bones, and this trocar point is basically used for cancellous bone drilling, cancellous bone. Okay, now you have understood types of pin, types of point of pins, and how to select the size of pin. Oh, sorry, not wire. Sorry, where. Now we have understood where. Next equipment is the ring. Ring can be a full ring, or it can be a half ring. half or can say partial ring, to be very exact, partial ring. It can be half ring, it can be 2/3 ring, 5/8, like that. It comes in different sizes. Partial rings are more versatile than the full rings because you can attach two partial rings to make a full ring, but you cannot make this one partial. Okay, so these are basically partial ring and full ring, nothing too new. These are some holes. Okay, regarding the selection of partial, we'll see how the ring is selected. Next is the wire fixing bolts, wire fixation bolts. So it is two types. This one, what you are looking is, it is cannulated bolt, cannulated bolt. So here you can see, for attaching to the wire, it has a central hole, cannulated central hole. Suppose what will happen sometimes, let me show you. Sometimes what will happen, you are inserting or wire, so in this particular end it is exactly at the middle. You see the hole is exactly at the middle. So when it is middle, it is easy to fix it here, okay, you have fixed with the cannulated one. While exiting to other one, suppose it going other one, it is not exactly at the center, it's slightly side. Okay, so what we will do, if you will fix with the central one, it will, the wire will have some tension, and this tension will be transmitted to the bone. So what you have to do for that, you have a slotted fixing. Here you will see it has a eccentric, you can say, groove. It has a groove, eccentric groove, through which you will pass, the wires will be tightened. Okay, also there come a combination, it will have a central as well as the eccentric one. Okay, so this is basically fixation bolts. Next is the connecting wire, the connecting frame. Okay, so it can be, this one is the threaded one, and this one is a telescopic one. I am slightly forgetting the name. It is, I think, telescopic one. This is not commonly used. Most commonly is the threaded one is used. This particular one, threaded one, is it will be fixed to the ring. Suppose this is the ring with two knots, one on the proximal, one on the distal. Then it will be fixing. The ring will be fixed. It is more versatile than the telescopic ones. Next, the equipments under wire tensioner. It is a very important equipment. Wire tensioner. So how much tension you need depending on the weight. Cats and dogs of less than 5 kg, they need no tensioning. Okay, after that, why tensioning is needed? See, suppose here you have applied a wire. Okay, the wire will be kind of loose because it is very thin, and when the weight will be put, okay, by the animal, or you can say that even if the bone itself, the limb itself, some weight will be put, if it is not tightened, it is loose, this particular will be hanging down. Okay, because it is weight, it is having some weight, so it will be, this fragment will move. When it will move, you see there will be no healing, or it may result in some additional pain. Okay, so for that you need some tensioning. So for cats and dogs less than 5 kg, you need no tension. For dogs 5 to 10 kg, you need 20 to 30 kg tension. For 10 to 20 kg dog, 30 to 60 kg tension. More than 20 kg, 60 to 90 kg tension. So tensioner comes with these two types. One is calibrated. You can see here some 50, 90, 110, 130 is there. Okay, this is calibrated. Another is uncalibrated. No calibration, uncalibrated. Okay, so ideally you should use two tensioners. Suppose you have to tension this particular wire, so you have to attach one tensioner here, one tensioner the other. Okay, tighten this one, then adjust this one with the calibrated one, how much you require. Suppose you have only one tensioner. Okay, one tensioner. So in that particular case, tighten this knot. Okay, this knot you have to tighten, then attach the other one, then tighten the up to your required kg or required tension. Suppose now it is easy with calibrated one. Suppose you are using uncalibrated one, how to do this one? So the technique is, suppose you have to do this one, this wire. So tighten this one, suppose you have one, tighten this particular bolt, then attach this uncalibrated one, tighten the wire. So you have to tighten up to that extent. When you leave this particular tensioner, it will remain in straight position. If it is loose, it will hang down like this. Okay, so when it will be remaining at this particular position after tensioning, then it is adequate tension. Then you have to remove this one. This is uncalibrated one, and this one is calibrated. In calibration, it is easy. So we have to do the required tension. This is tension error. Next is the wrenches. You know that to fix the bolts, you need knots, and the knots are tightened by the wrenches. Ideally, you need 2 wrenches. Okay, at the same time. Next, regarding the application, there are some principles. Obviously, like the linear external fixator, here you will have some principles. Here you need 4 rings, 4 pair of wires, and 3 threaded rods. Okay, 4 rings, 1, 2, 3, 4, 4 rings, 4 pair of wires, that is 8 wires. Okay, and 3 threaded bars or frame. These 3 threaded bands will be in the equilateral triangle. Equilateral. Okay, are the same distance from each other. Equilateral triangle. Sometimes what happens, this much length you may not have it. You may have short threaded ends. What you have to do? So in that particular case, for attaching these two, you have used here like this 2 and 3. For attaching this one, you have smaller ones. So you have attached here 1, here 2, and here 3. For this you have attached here 1, here 2, and here 3. Like this equilateral triangle, you can do your own frame. The principle is it should be in equilateral triangle. Okay. If you are not having length, full length threaded rod, you have smaller length, then by this you can adjust and make your own external ESF, circular ESF. Okay, and regarding this frame, you have to pre-construct before the surgery. How to do that? So first, what you have to do, you will do the radiological evaluation. From the radiological evaluation, you can see the bone length and the bone length, because most of the computed radiography, you will find the measurement things. Okay, those scales are there, so you have to measure. So you can measure the bone length, and after measuring the bone length, you can decide from where you need the 4 wires, 2 wires per segments, 2 pair of wires. Suppose you have to do here 1 point, here 1 point, here 1 point, and here you have decided in the radiograph itself. Okay, you have decided. Now you have to measure these distances, this. Okay, after measuring, simply mark it in this rod. Okay, these rods. When you will mark these rods, then simply place the rings. The frame is, external frame is constructed. Wires will come later. The external frame is constructed. Like this, you have to pre-construct the frame. Okay, so that the operation time can be less and you can apply in comparatively more fast, more easier way. Now, second principle, select smallest ring diameter, allowing a minimum of 2 cm between skin and ring. It was 1 cm. Here it is 2 cm. Between the, here will be the limb skin. Okay, here will be the limb skin. The distance between this should be less than, should be 2 cm. Minimum of 2 cm. Minimum of 2 cm. Okay, if it will more further away, then the frame will be destabilized. If it's more closer, the skin will be damaged. Okay, like this. Next, the FNF configuration. This is far, near, far in relation to the fracture line. Far, near, far. FNF configuration. In this way, this is pre-constructed. Okay. Now, proximal ring can be partial ring. This particular ring, especially when you be using for tibia and radius. Okay, for that bone, this particular ring can be a partial ring. Why? Because you see there will be thigh and the abdomen, here will be thorax in the anterior limb, so those can hinder this particular portion. Okay, the inside portion or the medial portion. Okay, so you can apply a partial ring in the lateral portion. You can apply a partial ring for lateral, for this particular one, proximal one, not all other one. Now regarding the wear application, the first the ring application, sorry, the first two rings should be first applied, or the wears also is first applied for the proximal and distal, similar to the linear external fixator. Next will be fracture, proximal distal to the fracture. Okay, here you see proximal to distal to fracture. The distance is 1 to 2 centimeter depending on different breeds. So these two, first one is the extreme one. This will be in the metaphysis, proximal and distal. Then simply proximal to the fracture and distal to the fracture. These four rings. Okay. Regarding the angle between the wears, ideally it should be 90 degree. Ideally. But practically it cannot achieve 90 degree. It is ideally in practical sense 60 to 70 degree. How? Let me show you some. Let me tell you actually. Suppose you are doing a fracture stabilization in the hind limb. Here will be the hock. Suppose for the tibia, it is you can place the wires from lateral to medial. Here it will be placed in pins, or suppose here wires. So you have used this one. So the exactly 90 degree will be on the gastrocnemius tendon. Okay, exactly 90 degree. You cannot insert through any tendons or neurovascular structures. Okay, that is why the ideal 90 degree is not achievable. So the practical one is 60 to 70 degree. Even the book suggests that 90 degree is very difficult to achieve. So 60 to 70 degree is alright. It should not be less than 45 degree. It should not be less than 45 degree. It should be more than 45 degree. Okay, at best. So these are the principles. Okay, these are the principles. Next, application. There are some steps. Did you understand the angle one? Okay, the angle is here, this particular angle. Okay, angle. Steps. So first one, fracture assessment, radiography evaluation. I just told you how to pre-construct the frame, pre-construction of the frame, FN and far near far configuration. Then select the wear on the basis of weight. Okay. Then patient preparation, all those things, patient preparation. Hold the frame. After patient preparation and doing all those things, so we have to insert the frame. Okay, like this, then hold it like this with an assistant. For a external fixator, you need 2-3 assistants. Okay, alone you can't do. So you have to hold the ring here like this. Okay, so after holding the ring, then you have to insert the pins. Wires. Then you have to drill the wire. So there is some techniques regarding drilling the wire. Let me show what are the things. So what you have to do? You have to avoid drilling through the soft tissue, and the wires are very thin. You do not need 1 centimeter long incisions for insertion. So what you have to do, simply by manual thing, you have to push through. Okay, like this, you have to push through. Okay, they are very thin, so it can easily be pushed through the soft tissues and it will lodge in the bone cortex. Okay, suppose this one is the near end cortex. You are inserting from this one, the near end cortex it will reach. Then drill to the far end cortex. After the drilling to the far end cortex, simply tap this one to go through the opposite far end soft tissue. Okay, the book suggests like that, but in practical you can simply drill through. Okay, you can do this one, but from a theory point of view, okay, from idealistic point of view, it is like that. Otherwise you can drill through. Okay, you can use lower revolutions, you can use. Next, okay, I told you, manually push the pin through the soft tissue, the near end. On the other side or the far end soft tissue, you have to tap through. Okay. Next, start with distal wearing, the most distal one. You have to start from distal one. Fix the wire to the frame with bolts. After insertion, you have to fix it with the bolts. Okay, here the bolts are used. Fix the bolts, whether the cannulated or the slotted or the hybrid one. Limb at the center and otherwise reposition. When you will be inserting the first wire, you have to check that whether this particular bone is at the center or slightly eccentric. Okay, so if it is eccentric, then adjust it to the center. Okay, that is the repositioning, otherwise reposition. Next, drill the second wire close to the first wire at an angle. Ideally it is 90 degree, or practically it is 60 to 70 degree. Okay, this can be achievable, 60 to 70 degree. Then re-examine the position of the frame, simply whether the bone is at the center or the limb is at the center or not. Okay, then insert the subsequent. This is the most distal one, then the most proximal one you have to apply. Next the proximal fracture, distal fracture. Like this you have to apply the wires. After the application of wire, I told you tensioning. Tensioning is very important. So you have to do the tensioning. Secure the knot at the one end, tension at the other end. If you are having one tensioner, if you are having two, then you can do in both ends. After tensioning, tighten the bolt. Trim the wires and then take the radiograph for evaluation of all the whether you have done good reduction or the pin and the wires are nicely placed or not. These are radiographic evaluation. Then do the dressing and the bandaging. Next, there is some checklist for circular external fixator. All rings should clear soft tissue, should not be attached to the soft tissue, 2 cm gap. All wire sides allow comfortable skin position. The skin should not be wrinkled at any place. Okay, all joints move freely, the above and below joint it should move freely. All wires are tensioned, obviously. All knots are tight. Any loose knots can have some significant complications. Okay, these are checklist. These are all about the circular external fixator. Next, the hybrid one. Will not much discuss about this one, less commonly used. If you are knowing the linear and circular, you can do this one. Okay, so the hybrid circular external fixator is of 3 types. First one is the when you will be using one ring, and this is unilateral uniplanar ESF, linear ESF. Type 1B, one ring, here one ring, unilateral biplanar. This is unilateral biplanar. Okay, and here this is a tie-in configuration. Here you can see my IM pin is there, it is tied in, okay, to this linear as well as the circular frame. Okay, this is type 2. Type 1B hybrid, type 1A. Next is the type B, where it is one. Okay, just find it, this one, this is 1B. Okay, and this is the tie-in configuration. So this is all about the hybrid one, nothing too much. If you want further studies regarding the hybrid one, I have given the link of the book in the description. Do follow that one. It is only 1 or half pages like that. You can read this one. Okay, so this is all about the external skeletal fixator, or simply external fixator. Next class we will go for the IM pinning, nailing, and I guess I will also cover the wires also. Okay, so the notes link in the description, do check them. Okay, and also if you like this content, do share among your friends, juniors and colleagues. Okay, so we'll meet in the next class. Till then, tata, bye bye, take care.